Hi, I'm Dr. Karyn. Today I'm going to talk to you about 3 letters that should terrify just about every dog owner. G, D, V. Gastric dilatation and volvulus, which is often referred to simply as bloat, is a potentially deadly disease that mostly affects large, deep-chested dogs. So what is it? The first part, gastric dilatation, also known as bloat, occurs when the stomach becomes fully distended with gas and liquid. The next part, the volvulus, occurs when the stomach becomes twisted on its axis. And this is the deadly part. When that stomach twists, it means that gas can no longer escape, and the blood vessels around the gastrointestinal tract twist and cut off circulation. And the longer that happens, the worse things become. While bloat can sometimes resolve on its own, GDV needs surgery to correct. In some cases, part of the stomach may need to be removed if it's become necrotic, and in other cases, the spleen may also need to be removed if it's played a role in the GDV. Even with surgery, there is still a really high rate of fatality in these dogs. And the sooner they get to the vet, the better the outcome. So why does GDV happen? Well, there are a number of different reasons, but sometimes the cause isn't really known. We know that large breeds with deep chests, like Great Danes, Irish Wolfhounds, or Boxers, are more likely to be affected because there is the room for the stomach to bloat and twist. Dogs that are fed too close to being exercised are at a high risk. If your dog is fed too close to the time they are exercised, that puts them at a huge risk. And eating too quickly can also predispose them to this. Dogs with a splenic tumor, benign or malignant, can also develop a GDV as the inflammation on the organ triggers movement within the abdomen. So what are the signs of GDV? Although signs can vary from dog to dog, the things you need to be looking out for are retching, trying to vomit but not necessarily bringing anything up, an enlarged, sometimes firm abdomen, restlessness, pacing, collapse, pale gums, and sometimes explosive diarrhea. If your dog gets a bloated abdomen, the first thing you should do is call your vet. This is an emergency, and every minute counts. Although it's not foolproof, there are some steps you can take to minimize your dog's risks of developing the deadly GDV. One is to make sure you allow at least 2 hours before or after a meal before exercising your dog, especially if this is strenuous exercise like running. Feeding only wet food, soaking your dog's food, or using a slow feeder sort of bowl, anything that slows down their eating can help reduce the risks as well. There's been a bit of debate recently over whether or not raising your dog's food bowl can increase their risks of getting GDV or reduce it. At the moment, the safest recommendation is to keep the bowl at ground level, as there have been some reports that raised food bowls can increase the speed at which dogs eat, which may increase their risks of getting GDV. However, some reports have suggested that food bowls raised to a shoulder height can reduce their risks, but the debate continues. Additionally, feeding 2 or even 3 meals per day can reduce the risks by reducing the amount of food held in the stomach at any one time. So if you're the owner of a large breed dog, particularly one with a deep chest, be on the lookout for the signs of GDV, because every second can count. And make sure you're taking steps to reduce their risks. Feed wet, feed slow, feed often, feed low.